So you just passed the NCLEX, you're licensed, and you feel ready. But 90% of your first year's problems are coming from 3 things that you were never actually taught in the lecture halls. These topics were drowned under mountains of care plans or math equations you may never see again. I'm looking at UDRIP calculation. Hey everyone, I'm Reese from MinuteMers. I'm a critical care transport nurse with experience in the ICU, ER, and on the ambulance. This video is going to go in depth on 3 things that I think are super important to know for new grad nurses. So you walk into the floor where everyone is rushing. You feel pressured to rush as well. But the difference is a great nurse knows how to slow down and remembers that patient safety is their #1 priority. Forget the checklist and the pressure to be fast for a minute. The real system is slowing down for a proper assessment. This assessment must happen at the beginning of your shift. That way you know if there's been a change at all later on. Remember to stop and look. Listen to their lungs, look at their skin, feel their radial pulse. 90% of nurses actually just glance at the monitor. It's kind of terrifying. You must learn to be okay with the small things taking a little bit longer because that slow, high-quality assessment is the only thing that actually prevents a code. Protect your patient and your license by taking the time to truly assess your patients. Skill number 2 is how to give a great handoff. I'm not talking about the head-to-toe shift report that you give your fellow nurse at the end of shift or in the beginning. I'm talking about your patient is crashing and 20 people just ran into your room. You need to know exactly what's important and what to tell them. Do not start with the H&P. You want to start with the one sentence that everyone must hear, the clinical snapshot. This is also known as the situation or S in SBAR. An example is this. This is Mr. Smith, 68-year-old male. He's here for sepsis from a UTI. He's suddenly really altered and he's now hypotensive with a new arrhythmia. That tells the entire room the core problem and the immediate concern. Then we want to use the SBAR framework to kind of fill in the blanks. B is going to be your background, which gives the patient history. A is for an assessment, which you did in the beginning of the shift. R is for response, or what you've done and how it's helped or hurt the patient. You want to make sure that everyone in the room during a rapid response or code blue knows exactly what's going on. It's incredibly important. Before heading to the last skill, please remember to like and subscribe. If you enjoy these breakdowns of complex topics, I want to make them into easy, digestible videos for you. Skill number 3, or the last skill, is recognizing subtle declines in your patient. This is kind of like doing that good assessment we talked about, but this one focuses on trusting your gut when you notice a subtle change in that patient. Nursing school makes you look for massive drops in blood pressure or high fevers, but the true critical care is catching those small changes that are going to be problems in the future. When I walk into a patient room, the first thing I look at is the patient. Do they look like something's wrong? From there, we can kind of move into the monitor and check out those vital signs. You'd be surprised how much info you can get from just looking at your patient's skin. Pale and diaphoretic means you're in for a really long shift. Trust your gut when you notice these changes in your patient. Don't wait for the patient to just magically improve or for it to roll over. Call the resident, or better yet, just call the rapid response team. All of these systems aren't in a textbook. They come from experience. Start by implementing that great assessment, getting a great handoff report, and trusting your gut. What are some of the other things that you've learned so far in your nursing career that you may not have learned in nursing school?